So I have a bachelor in nutrition science from Bogor Agricultural University in Indonesia, and I have a master's in food innovation and health from the University of Copenhagen, Denmark. These two study programs are not completely linear, yet complementary. So in my bachelor, I learned a lot about the impact of food on health and well-being, but the focus is much more on the nutrient of the food itself instead of the consumer. Meanwhile, in my master's program, I look at food in a broader perspective and try to focus on the consumer, and that way we use a sensory science approach. So my PhD project is an intersection between nutrition and sensory science. It's a collaborative project between University Lyon 1, University of Copenhagen, and Institute Paul Bocuse Research Center. So the objective of my research is to understand oral somatosensory perception in cancer patients. That is including perception of texture, temperature, and chemesthesis, such as astringency, pungency, and carbonation. So far, there are a lot of studies investigating taste and smell alteration in cancer patients, but then food is beyond just taste and smell. So I am trying to investigate this potential missing piece to really understand their food perception and how it influenced their eating behavior. So based on the literature review that was conducted, we observed that the term taste is often used inaccurately as a colloquial term to refer to food flavor. So when we look at studies that investigate these taste alterations, we really need to question and rethink whether the problem lies solely on the gustatory function, or does it also involve other dimensions of flavor perception, such as the olfaction and the somatosensation. So there are fundamental aspects of research that I continuously learn during this PhD. For instance, developing critical thinking, conducting literature review, planning experiments, and writing scientific papers. But on a personal and professional level, since my project involves different kinds of experts whom I'm very lucky to work with, it also means I have to accommodate and consider different kinds of opinions and work together to find the best course of action. So there's a lot of project management experience that I gain from that. So in the research center, we have different research groups: the nutrition team, cognitive science team, social science team, and of course the experts of gastronomy. So I benefit from this multidisciplinary field and the different perspectives on looking at problems. This project might highlight the under-researched aspect of oral somatosensation and mouthfeel perception. This is a less explored area, especially in the clinical population, yet may influence eating experience and appreciation of food and meals. So ultimately, we aim to translate the knowledge that we gain from this project into practical applications to improve cancer patients' eating experience and well-being. It can be in the form of developing meals or food products, as well as providing guidelines or dietary recommendations that are adapted to their sensory alterations.